I'm Dave LaRoe, Chief Operating Officer of Medicomp Systems. Today we'll be demonstrating three of the most significant breakthroughs of CliniTalk, our newest tool for patient care and documentation. In front of you, you see a screen that's going to look familiar to most physicians. It looks like a note, but there's a bit more going on. What we're trying to do is show the breakthroughs we have made with a single screen for patient management and documentation. The second breakthrough we're going to show today is speaking directly to a powerful clinical knowledge engine. And the third breakthrough will be using dictation to create text so the doctor can say whatever he or she wants in their own words, and we will convert that to actionable clinical data linked to the same powerful clinical knowledge engine. On the screen right now, you are seeing a patient with three problems. Before we take you through some of the methods for using CliniTalk, which we have tried to keep fast and familiar, let's take a moment and look at the screen. On the upper right, you will see the patient workspace. In the patient workspace, you can see the three active problems of the patient. This is a patient with congestive heart failure, type 2 diabetes mellitus, and hypertension. Below that, you will see that vital signs have been previously collected by the nurse. Following that, you will see that my personal preference is that I would like to have my prompts, my templates, my guidelines, whichever it is that I'm typically using, loaded automatically when an existing patient comes in with current active problems. As new problems are explored, as new complaints are taken, they will be added automatically to the patient workspace. Below the patient workspace, on the lower right of the screen, you will see a list of favorite resources. These can be templates, forms, images, or guidelines. On the left side of the screen, you will see what we call the note workspace. Although it looks like a note, every item in that workspace now, all the items in gray, are candidates for entry either by clicking or by speaking. Some people call these the gray ghosts. They are items available for entry. Though this looks like a note, it is actionable clinical data, which we will explore in a few moments. You will also notice that several of the items in the left side are underlined. Difficulty breathing, for example, has an underline. This is because that particular clinical data element has previously been documented in this patient's chart. This tells the user in one single view what the patient's problems are, what's been collected by somebody else in this encounter, what resources are available to them to manage this patient and document, and if any of the items which are in this single note view have previously been addressed for this patient. Moving along to the next slide, you will see that difficulty breathing has been entered. When I clicked on difficulty breathing, it's my personal preference that one click means abnormal, and it comes up in red. You see difficulty breathing now in red for abnormal. You also see a few other things to help me with the context of difficulty breathing. In the patient workspace at the upper right of the screen, you will see congestive heart failure and hypertension are both in bold. What this tells me is difficulty breathing is included in the items that are relevant to the evaluation of congestive heart failure and hypertension. You will also see a tab strip at the bottom of the screen. This tab strip shows me that I'm now in the current note, but as we previously mentioned, the underline for difficulty breathing means that that item has occurred in this patient's chart previously. And you can see in that tab strip on May 12, 2009, that item is in red, that tells me that on that date, difficulty breathing was also abnormal. You'll also see that previous to that, on September 3rd, 2008, see that date in blue, that tells me that on that particular date, difficulty breathing was normal. This information always appears in the same place on the screen. It tells the history of this item without having to ask for it or go look it up. This is very important when evaluating an item to determine if this condition is new or not, or if the therapy previously used was effective. Moving on to the next slide, you'll see that it's very straightforward to go and look at difficulty breathing in the clinical context of the encounter on September 3rd, 2008, and you will see that it shows me in context on that date, at that time, this patient reported no difficulty breathing. I can click on any date and I will see that item that's highlighted in its clinical context on that date, and then quickly move back to the current note. Let's take a look at the physical exam. You can see the physical exam. Patient's pulse rate today is 74 beats per minute. At the bottom of the screen, in that same tab strip, because it's always in the same place, you can see that on September 3rd, 2008, the patient had a pulse rate of 130 beats per minute, and prior to that it was 75. This automated look back in context becomes very powerful when dealing with laboratory data. Moving on to the next slide, one of the advantages of having a note that is actually a data document tied to actionable clinical data and a powerful knowledge engine is if I ask to be able to focus on a specific condition, in this case, I've clicked on a prompt of congestive heart failure. You can see on the left side of the screen in the note workspace, the items highlighted in green are relevant for the evaluation of congestive heart failure. If I go to the plan on this slide, you can see the plan items for congestive heart failure are highlighted in green. If I want to focus on another condition, such as diabetes, I can click on that. The relevant orders for diabetes are now highlighted in green. And if I click on one in the next slide, I can order right from this screen. And when I order the renal function panel, for example, you see that renal function panel is considered relevant in the patient workspace for congestive heart failure, diabetes, and hypertension. And I know that because they're all in bold. Now, let's switch modes. So what we've shown so far is what we consider one of the key breakthroughs for CliniTalk. A single screen for patient management and documentation that has a problem-oriented, patient-specific view of information. It's the same presentation to manage the patient as it is for documentation. You can see clinical items in context, both in the current encounter and for the patient's entire chart in one screen. Doctors are telling us that this is fast, familiar, easy to learn, and easy to use.